There is a growing number of people who are regularly using inhalers for asthma and nasal spray for sneezing. Beginning as sneezing, throat irritation, nasal congestion, and breathing difficulty, and developing into sinusitis, tonsillitis, adenoiditis, infection of the trachea or lungs, resulting in repeated course of antibiotics is now becoming more common. Simultaneously, there is an increase in patients undergoing tonsillectomy, adenoidectomy, sinus surgery, septoplasty, etc. There's a growing number of young children who are losing through surgery important organs of the immune system like the tonsils and adenoids. Why is this happening? Why do those suffering from allergy have repeated infections in the tonsils, adenoids, trachea and lungs? What causes allergies? The reason for allergies and asthma is the imbalance in the body's immune system. The immune system becomes hypersensitive to some items and overreact to their presence. Allergens can cause a range of conditions like breathing difficulty, asthma, skin irritation, sneezing, nasal congestion, throat irritation, irritation in the eyes, etc. When we correctly understand the answers to what is an allergy, when does it happen, then only can we overcome both the discomforts of the allergy and allergic medicines. What should those suffering from allergy and asthma pay attention to? How to overcome allergies and asthma? Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind the health condition, measures for early detection, tests to assess the current status of the disease condition, present treatment options in modern medicine with the benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and impact of correction of lifestyle has on reversing and preventing recurrence of this health condition. This is why the video may appear long. To help you save time, we have time-stamped the topics in the description below for those who prefer it. Here the focus is on those who would like to make more informed decisions on matters concerning their health. This is important especially when they would like to avoid surgery and chronic medication with the added effort from their part. It should be remembered that those who are on medication should reduce or stop medicine only under medical supervision. Allergic disorders occurs due to a disorder in the immune system. To know about it, to understand about allergy, we should first understand what are the organs related to immune system. The immune system is actually spread out in all our body. The skin, mucous membrane, that is the skin is protecting our skin from outer external world, and then the mucous membrane actually protecting the internal organs, the tracts like respiratory tract, gastrointestinal tract, urinary tract, genital tract. All these are actually covered with the mucous membrane. Then the strategic points, just like our defense system, like a naval base, army base, or the air base, for each country there will be different system. These control stations and defense stations will be there. Just like in our, most of the things are coming into our body. The air is coming through the nose and the food and other fluids and all come through the mouth. So at the back of the mouth, there is three stations, that is two tonsils on either side and adenoid back. So they are actually the important protective immune system organs. Then actually the immune cells, the soldiers, WBCs are made in the bone marrow. That is bone marrow, there are around 230 bones in our body. And this bone, inside that the bone marrow, and from that actually the WBCs are coming out. So when they come out, these neutrophils, they will just go to the blood directly. But the lymphocytes, they are going into the thymus. Those lymphocytes which is going into the thymus, and they are educated there to understand what is self and non-self. That is to make the immune system cell distinguish or understand which is our own cell and the outside inward. So that is happening in the thymus. And those cells which are coming out, passing out from the thymic school is called T cells. Actually, T cells have an important role in controlling all the immune system activities. There are helper T cells are there, killer T cells are there, and different types are there. And there are another type of cells is called B cells. The B cells are actually producing the antibody, and they are stimulated into another form called plasma cells, and the plasma cells are producing antibody. There are other different type of cells called mast cells also. Actually, it's an immediate reaction for the allergic, like sneezing, itching, and wheal formation and all, is due to a special chemical released from this mast cell called histamine. This histamine release happens immediately. Actually, for the allergy, the allergen first comes into our body. Usually, there will not be much reaction. But if when it is repeated exposure only creates allergy actually. With repeated infection, body produces IgE antibodies, and the next reaction they will attach to the mast cell, and the mast cell will release histamine. Actually, this histamine is creating the problem basically. And there are other chemicals also like leukotrienes, prostaglandin, etc. also is an important playing in the part of producing allergy. And another important, even if there is not much allergen, also some people with the histamine intolerance, that is that is a genetic condition in which histamine, there is a even though with the normal amount of histamine itself, when the histamine comes after some time, it is degraded into a it will be metabolized. But persons who are lacking diamine oxidase, it's a special enzyme degrading or metabolizing the histamine. So in the absence of, or in the family hereditary or something like that congenitally, if you are having a low production of this diamine oxidase enzyme, these patients or these people also can narrate an exaggerated reaction, because there will be that histamine will be loaded. Even the natural food also contain histamine. So those food items which contain more histamine will be not be reactive, can produce a allergic reaction to in such patients. Especially that is very common with it is actually old fish. If the fish, it may not be rotten fish or anything, but it is if it's stored for a long time, the fish histamine level will increase. And this sort of people who are having a histamine intolerance, they can get diarrhea, vomiting and all. That is actually, these IgE mediated reactions are called a type 1 reaction. It is very fast, and immediately itself it can happen, like this anaphylaxis reaction when someone got with an insect bite and all, or with the penicillin injection we are getting an anaphylaxis reaction, or any type of reaction which is immediately happening. It is usually type 1 reaction. Next is type 2 reaction, that is actually mediated by IgG and IgM, another type of antibodies, and it can take 2 or 3 hours or maybe more. And next is type 3 reaction, that is actually immune complex mediated reaction. That is that it involved IgE, IgG and complements, and phagocytes, different types of cells also involved, and also IgE and complements. That is all different type of chemicals in the immune system chemicals. Next is type 4 reaction, that is actually cytotoxic, T cell mediated. It's actually basically it is cell mediated reaction. That is can be delayed, and 2 or 3 days after you take in the exposure to antigen, after 2 or 3 days or even 3-4 days will take it to manifest. That is happens with many this rheumatic fever and some sort of this fever, basically when it comes, we call it, usually it manifests as an autoimmune disease. Even though it is a problem with the allergy and immune system, it is a delayed and it is progressive, so it is usually comes under the autoimmune diseases. Next, when we talk about the immunity, we should understand that there is 2 aspects in immunity. One is inflammation and the other is anti-inflammation. Inflammation means the defense part. Anti-inflammation is the healing part. Inflammation is mediated through the omega-6 fat. Anti-inflammation is mediated through the omega-3. Omega-6 actually fat is very plenty available in our food, like all the nuts, like groundnut, cashew nut, badam, pista, all contains very high amount of omega-6, but most of them doesn't have much of omega-3 at all. And omega-3 is mainly very small, usually in our food, very small quantity also. That is in salmon, sardine, and leafy vegetables, and some dal like urud dal. This omega-3 and 6 are essential fat actually. So it's omega-3 fat and omega-6 fat you cannot make in our body. So it acts like a vitamin and it has to be taken through the food. When there is an excess of omega-6 in the food and low omega-3 in the food, this inflammatory reaction can be aggravated actually. So almost all this allergy and almost all the lifestyle disorders like diabetes, hypertension, cancer, autoimmune diseases, all are actually inflammatory diseases. Actually, the inflammatory diseases are going high because of this disparity in the omega-3 and omega-6 fat in our food itself, and also when the more and more omega-6 is stored in our body, especially in overweight and obesity, the chance of getting allergic reaction will be high, and also all the other inflammatory disorders comes under lifestyle disorders is high when this the obesity will be the initial triggering factor, but there can be the allergy and asthma can occur in normal weight, even underweight people also. That is all. There is different mechanisms are coming. There is an environmental factor, and also the genetic factor will also play in that. Next, we come into what are the different types of allergies. The allergic rhinitis, asthma, atopic eczema, that is skin disorder, and drug allergy, food allergy, insect or venom related allergy, or multiple sort of allergies can occur. And even headaches, some of the headaches can be because of allergy, some food or even the smell. Some smell will trigger a headache for the people, and even some food. And also the headache can occur as a result of chronic allergy and sinusitis. When a patient, the person with a repeated respiratory allergy and irritant is coming, the sinus, the cavities in the bones of the facial bone or the skull bone is getting infected, and that also is covered with the mucous membrane. This mucous membrane get infected, and that is called sinusitis, and the pus can get collected in the sinuses, and that can also create it. But basically the problem starts with the allergy itself. And the sleep apnea, there are many patients having difficulty to sleep and getting in between off and on the sleep problem. That is because of the edema of the respiratory tract, and also many of them will be obese also. That also actually, when the obesity comes into, the fat will be accumulating in the everywhere in the body, and even in the respiratory tract, and that area will be, so it will get narrowed because of the excess fat inside. So both ways, that because of this inflammatory reaction, there is edema is there, and also fat accumulation, and even the fat itself will create more inflammation. That is one of the reasons for this sleep apnea, for these patients with upper respiratory tract allergy. Then it can lead to adenoiditis and the tonsillitis, the two major guarding immune system organs, the tonsils and the adenoids, can get infected because of the overwork, and they themselves get infected. Then when we come to the symptoms, that is, the symptoms will depends on which part the allergic reaction is expressed. If it is in the skin, it can be veal and hive. If it is in the nose, it will be sneezing or the nasal block or watering, eyes itching or watering, throat also again itching, or then it progresses to infection. After initially it may be throat pain only, or slight irritation. Then we can see that some, especially the children and all, after they take some junk food like ice cream or this juice, this artificial colored and preservative added juice and all, they get initially there will be a slight irritation, and then it goes into, after a few days, it will get infected and go to upper respiratory tract infection. Then when it comes to the lungs, that is the VC and the asthma. Then when we come to the mucous membrane, the mouth ulcers can come. Next is gastrointestinal tract, where there are also most of the gas and other irritability, and also can and be because of the allergic reaction, gas, vomiting, diarrhea, and even piles. We think it's generally it comes under autoimmune disease, actually, piles. Previously, we was not knowing what is the reason. Next is anaphylaxis reaction. When the it's a severe reaction comes, like a antibiotic or a certain drug injection and all, you can get an anaphylaxis reaction, or an insect bite can create anaphylaxis reaction. In that, actually, the blood vessels are involved. The blood vessels becomes leaky because of this large release of histamine all over the body. Whole system is done. Because of the leak in the blood vessels, the blood volume will go down. That is the reason these patients get fainting attacks and all. So immediate reaction, immediate medication, and the medicines like adrenaline and steroids are all, if not given, the patients will be dangerous and even death can happen. Even the latest findings shows that this migraine, and that is called vascular headache generally, and it has a connection with the food intake also. Many food can trigger this vascular headache. That is actually the brain blood vessels in the meninges, that is the brain covering and all, is get dilated and creating pain. So there are many. That's a different. Any system can be affected. If according to the system, the symptoms will be different. If the nose or the lungs or the skin or even the brain can be affected with this allergic reaction. Like if it comes in the brain, you may get a headache actually. Next is the investigations for this allergic disorders. Basically, we can check the antibody level, that is especially the IgE level, and also we can check IgG and IgM levels also, different types of antibody levels. These patients with the asthma and allergy will be more, the IgE level will be very high, and also the blood count, especially the eosinophil count. And we can do the allergy test, that is actually to find out which are the food items. You can check the allergy to food items and also the contact allergy and the inhalants and different types that we can. Previously we were doing the skin prick test and patch test and all, but now very sensitive blood test is available. Previously we had only this IgE mediated reactions we can find out, but now there are available with the IgG mediated reactions, especially for the food we can find it. That also will help can help the patient to manage the disease. Especially the doctors can advise if you are getting, and I'm basically giving clinically supported lifestyle correction. In this finding out which how the body is reacting to different food items is very important actually to give direction for the patients. And for the allergic patients, if it is a long-term allergy, definitely other systems also will be involved also. So the asthma patients, it is very important to can check the pulmonary function test, how much problems we can do. And also most of the allergy patients, there is a possibility of going into autoimmune diseases, especially affecting the kidney. Nephritis can occur. In that case, RFT, that is renal function test, especially the GFR and microalbumin, urine albumin test has to be done, because otherwise we will find out there is a renal problem only at the end stage. If you are allergic patients, therefore always check their GFR also to see that their kidney is not affected, or if your kidney is getting affected, then we should give more importance. And liver function also, because liver is actually very well involved in almost all these activities, so it is very important to know the liver function, and also to see the metabolic activities, the lipid profile, cholesterol, triglycerides and all. And if the patient is obese, and especially there is prone for the heart problems, the cardiac markers and also the inflammatory markers. Cardiac markers like this lipid profile itself is a cardiac marker, and also troponin test and all we can do, and also this autoimmune antibody test. And many patients who is on a long term having allergic disorders like itching, sneezing or asthma, they are prone for getting autoimmune diseases like thyroiditis and arthritis. Within usually many people, actually within a few years itself, other systems also, because it's an immune system disorder. Even if it is allergic manifestation, it will be there and you'll be taking medication for the allergy, or even we are doing the desensitization, but after some time it will other immunological disorders like autoimmune disorders, even cancer possibilities will be higher if you're on chronic allergic disorder, and also even if you are taking medications for that to suppress the symptoms. Next is, what are the cause for the allergic? One is genetics. There is family predisposition and also the environmental. When the environmental pollution, air pollution increases, definitely there will be allergic disorders will be high. And the lifestyle, what you eat, or what is the air, the quality of the air inside your house and the car. We are using so much of perfumes and air fresheners. So this all add as a toxin for that. It is not only the factory fumes or the vehicle fume. It is actually this perfumes and fresheners and even the soap. All is having some chemicals actually. These are all chemical and all is adding into our toxin level. So it is giving stress for the immune system. Stress is not for our brain or our mind only. It is actually immune system also is stressed when you are taking so much of toxins into your body in the form of cosmetics, and even the color and preservatives and the tastemakers in our food. They are all, actually the body needs only the nutrients. Through the air, we need only that oxygen, and we have to give out the carbon dioxide and get oxygen. But we are getting so many other things to make the room smell good. And actually all these things are adding the immune system stress. Our nose is getting stressed, the throat is, and also the lungs. That is one of the reasons for those who are having allergic, even respiratory allergy, allergy especially. You should see that you avoid all these perfumes and things like that. And another thing is in the food or the cosmetics. Cosmetics also, you may be applying only on the externally, but all of this skin can absorb so many these chemicals directly. We are applying ointment on the medicines also as ointment and gel and all. That is because it is get absorbed and you get a relief. Just like that, what if you are applying a cosmetic is not a nutrient or anything. It only contains chemicals that is also adding into the stress of the immune system. So, and also the hair treatment things like a hair color, hair straighteners, keratin treatment. It's all actually adding the stress of the immune system, because it is whatever is applying on the hair also it will go into trip into the hair follicle, and hair follicle is very vascular tissue. So the blood, it will absorb into the blood. So that is whoever is having an allergic disorder or any disease, it will, if you should reduce the chemical intake either through air or through the food or through the cosmetics. We should try to reduce to the least. Next, when we come to the treatment, there is what is the medicines available? We have oral medication, injectable, nasal drops, spray, inhalant, ointments. And when it is an emergency situation like anaphylaxis, if you are getting after taking penicillin injection or some other injection, there are so many medications which can produce anaphylaxis reaction. The immediate response is actually immediate treatment is actually to inject a steroid, high dose of steroid, and also adrenaline. That is another hormone. Steroids also the hormones. This adrenal hormone produces adrenaline, and also this steroid hormone. That is actually used as a emergency medicine. Then it's antihistamines. Antihistamines like cetirizine, anti-leukotrienes like montelukast. And that is actually giving all these medications used for allergy and even autoimmune diseases are blocking the immune system. There is a different points of immune system blocking. Previously I told that there is omega-3 and omega-6. Actually this omega-3 and omega-6 fat is controlling the immune system. And this omega-6 is inflammatory and omega-3 is anti-inflammatory. That is healing, helping for the healing. This actually almost all these medications that is mainly used in the modern medicine itself is actually blocking this omega-6 pathway, that is the arachidonic acid pathway. that is anti-leukotrienes, montelukast, that is actually the COX inhibitors for the pain relief, all are acting on this pathway actually. Even the steroids, they are also immunosuppressants. So for the symptomatic relief, whatever is we are using is actually the anti-inflammatory or the immunosuppressants actually. Then another type of treatment for this is especially this inhalant allergies. This is immunotherapy actually. That is desensitization therapy. That is injecting small quantities of the allergen itself into the body and in making the body not to react. That immune system, you're shutting down the immune system to that antigen. That is especially when that is air, the inhalant allergies, food you can control by yourself, but the inhalants you will not be able to control. In such cases, that way, that is also effective for many people it is effective. But what I had seen is that in my experience, after this desensitization, that allergy, this sneezing, asthma and all can go. But those patients can present with autoimmune disease like arthritis and thyroiditis and all. So such patients you have taken this desensitization therapy also should be taken care to see that any autoimmune disease is coming for them. Maybe it will not be immediate or anything, but there is a possibility. Or even those who can take an asthma problem, they had taken desensitization, problem is gone. Then after some time they may get a skin problem like eczema or psoriasis or something like that. Then another line of management is the latest in the treatment protocols are the monoclonal antibodies. Monoclonal antibodies are actually blocking this all immune reactions. No? It's blocking another, that's also immunosuppression or modulation, whatever we call. It's all acting on the immunological path, and there are mepolizumab and omalizumab and all. That's all MAB actually, monoclonal antibodies. That is actually that the end will be given. Usually they are injectables and very expensive also. Usually it will go, if for a treatment it will cost in lakhs if it for a month, for a year and all. And what are the problem with this, all the medications for the allergy is only for the symptomatic relief, only for some time. When the effect of the injection or the medicine is over, you have to take the next dose, or otherwise you had to avoid the allergen itself. So if you are taking a nasal spray, or if you are taking an inhaler for the asthma, after the time, if you are not taking it by the 12 hours or 8 hours, you will get it again. That is the problem. Even this MABs, that is monoclonal antibodies, there also has, initially there will be a result, but after stopping it for 3-4 months, or depends on the patient's thing, it can, again the problem will come. That is the problem. Then what is the role of surgery in the allergic disorders? That is when actually, because of the allergy, this mucous membrane polyps are on most of the nasal surgeries or the ENT oriented surgeries are either tonsillectomy, adenoidectomy, and this endoscopic sinus surgeries, rhinoplasty, septoplasty, sinus surgery, and turbinoplasty. That are all happening in the nose. Actually, all the surgeries are for the this allergic disorders which is continuing. That is actually the chronic, because of this allergy, chronic inflammation and the thickening of the mucous membrane and giving it to polyps are coming, are blocking the sinuses and getting a sinus infection, or because of the repeated this allergic reaction, these tonsils and the adenoids are fed up, actually tired of reacting to the allergens, and also there is bacteria and viruses are all coming into the mouth, so they are getting infected. So because of the recurrent infection and the antibiotics are also the more maximum doses of antibiotics are used for the respiratory infection itself. These antibiotics are needed to treat the infection, and the infection came because of allergy actually. The system is weakened because of allergy, then the bacteria or viruses or whatever enter into that. So to prevent that, what is actually we are doing? To prevent the infection, we are removing the organ itself. So that is not logically correct. So when you get a infection, if you are able to find out the real cause, what is the allergen, and if you can avoid, you don't have to remove, you won't get the infection itself if you are able to avoid the allergic factor. So when we come to the solution, we should understand that it's a lifestyle disease. And it is not because of the lack of any antihistamine or anti-steroids. The reason is actually the exposure to an antigen or something which is our body is overreacting. The allergic disorders actually are an overreaction of our immune system. So this overreaction is coming because there is a disparity in this inflammatory activities and the anti-inflammatory activities. So much of weapons are there. This inflammatory, defense-oriented activities are so much there. There are so much soldiers, so much weapon. But the healing part, the anti-inflammation, the omega-3 is low and omega-6 is high. So a person who is having allergic disorder should reduce the omega-6 intake, like nuts, this vegetable oils. The consumption should be reduced. And the small leafy vegetables, sardines, salmon. So such omega-3 containing food you have to increase. And also to avoid the toxins, additives in food. And even the medicines are actually, it acts as a toxin. And many people who are actually start getting allergy after taking so much medicines for the diabetes, hypertension. And there may not be a childhood, there is no allergy, nothing. But after 40 or 50 years, they're getting starting allergies, sneezing, etc. That is, one is accumulation of fat, accumulation of omega-6 fat inside our body. That is the reason when later life you are, initially there was nothing, and later life, that is all lifestyle diseases are coming like that. Only when you are initially there is usually there is no diabetes, hypertension, and all is the old age diseases. That is because of the accumulation is toxins, and even the fat is a toxin, especially when it comes to omega-6 fat, it is accumulating in, the chance of getting an allergic disorder will be high. So what we had to do, we had to, if you are overweight, do the exercise and reduce the excess fat, burn out the excess fat, and also avoid the color preservatives, tastemakers, or anything not coming under the nutrient, you have to come out. And also the medicines. This diabetes, hypertension, cholesterol, all are lifestyle diseases. It's not because of the lack of medication it is happening. If you're willing to correct the lifestyle, you can come out of the medications. Those who are not able to find out what is the allergen, and also if someone is on so much of medications for other diseases, or along with the allergy, you are continuously taking allergic medication and there is you need it, or even with the medications you are not comfortable, or those who are having other diseases like arthritis or thyroiditis or any autoimmune diseases also appearing, then you may not be able to find out and correct it by yourself. Then you may need a clinically supported lifestyle correction. In brief, first, immune system related malfunction is the cause of allergic disorders. Second, allergies affecting the respiratory tract cause asthma, sneezing, nasal congestion, etc. Third, the immune system has two branches, one inflammation or defense, two anti-inflammation or healing. The excessive activity of the inflammatory or defensive response is the reason for allergies. Fourth, only when the allergens that stress the immune system are identified and avoided, and rest is possible for the immune system, allergies can be overcome. Fifth, the inflammatory and anti-inflammatory reaction of the immune system is regulated by omega-3 and omega-6 fat. Imbalance in their proportion in the body is a major reason for allergic disorders. Sixth, in modern foods, omega-6 content is very high while omega-3 content is very low. This increases the possibility of excessive inflammation or defensive activity which result in allergies and other inflammatory disorders. Seventh, the excessive omega-6 in obese and overweight increases the possibility of allergies and asthma. Eighth, for the proper functioning of the immune system, it is necessary for an optimum proportion of omega-3 and 6 in the food. body fat and cell walls. Additionally, it should be possible to reduce the toxic exposure while ensuring the correct quantities of nutrients for the body. Ninth, long-term use of allergy medications increase the possibility of inflammatory disease like diabetes, hypertension, obesity, cardiovascular disease, arthritis, autoimmune disease, cancers, etc. 10th, when the allergens are identified and the immune system is optimized, it is possible to avoid most surgeries of the nose and throat like tonsillectomy, adenoidectomy, septoplasty, sinus surgery, polypectomy, etc. 11th, it is good to remember that allergies and asthma comes under the group of lifestyle disorders. If the causative lifestyle issue are identified and corrected, it is possible to overcome such disorders. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease conditions. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease. What purpose does the surgery serve? The on-table and post-operative risks associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders, who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunistic and take advantage of the surgical options available primarily on the financial availability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserves maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even death from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is constrained by chronic lifestyle diseases, and if the advantage of reversing them with lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for a majority of surgical interventions. We need to be proactive in health and not wait for the disease conditions to reach a stage where we lose hope of the ability to actively reverse our health problems with self-motivated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer, and this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery, and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center Tevara, Kochi. I focus on lifestyle modulation with the clinical support, minimizing medication and surgical interventions for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrient formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition, along with the Oxyflex, is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medication and surgical intervention. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fatty tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like heart, liver, kidney, pancreas, etc. Status of the system like circulatory, immunity, endocrine, metabolic, etc. and the compatibility status of food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulations restores and retain optimized circulation, metabolic activities, hormone balance, immunity, and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition and help the repair and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome the vast majority of lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune diseases, cancer, etc. This also helps to avoid the need for medication and surgeries. Next is what are the benefits for the patients with the allergic disorders with the clinically supported lifestyle correction? Basically, in the clinically supported lifestyle correction, what is given is actually optimal nutrition from the minimum number of ingredients. Actually, we are giving a special food to ensure all the nutrient in a minimum with the minimum number of ingredients. But everything, all the 57 nutrients, at least 55, and the next is water and oxygen, is there, ensuring for the body. And the activities to stimulate the immune system. To stimulate the immune system, you have to stimulate the bones. The immune system cells are produced inside the bone. So you have to do the activities to do as to stimulate all the 230 bones, and there are almost 650 muscles. We cannot directly activate the bones, but we can activate the muscles. So with the exercise, especially formulated exercise pattern, we are stimulating all the try to stimulate all the bones in the body, so that indirectly you can stimulate the not only immune system, the whole hormone system, all the system you can stimulate only through the actually. The only thing which we obey, you can do voluntary, is the skeletal muscle. So With the exercise, you stimulate all the, try to stimulate all the cells in the body actually, and then to reduce the toxins entering in the body. So to avoid this colors and preservatives and even the medications. Even with the clinically supported lifestyle correction, we can stop. If you are taking diabetic medicines, you can stop the medicines for type 2 diabetes. You can stop the first stage itself. Type 2 diabetes means there is enough insulin in your body. So you only to make the insulin sensitive. Actually, it's an immunological imbalance. It's the reason for this insulin resistance also. The latest study shows that there is an immunological imbalance, and the production of the quality of the insulin is not good, and so many mechanisms. We are not going into those things. And to reduce the toxin means the color preservatives and even the cosmetic use, reduce on such things, body care use. We give only the nutrition oriented body care product and the food nutrient oriented. Next is to remove the toxins which is already deposited in our body. That is actually the most of the toxins are dissolved in the fat, inside the fat. Fat itself is excess. Most of these patients will be having excess fat in the body. Even if the patients who are underweight also will be, or normal weight or underweight also will be having excess fat. In such case, the fat, burning out the fat is important, and building up the bone and muscles. Actually, when you stimulate the muscle and the bone, it is actually the weight or you are building the body also, building the muscle, building the bone, and removing the excess fat. Because the fat will be having excess omega-6, that is inflammatory, that is creating all this problem. So remove the excess fat, especially the omega-6, and give more omega-3 fat. Actually, high omega-3 fat is given as a nutrient, support nutrient also. To give clarity and of the clinically supported lifestyle correction for this allergic patient, I'll give you an example of a patient. She's a lady, 58 years, and her height is 158 centimeters, and her weight is 67. She's overweight. And she's suffering from asthma and allergy, and also varicose veins. That is her diagnostically, it is asthma and allergy and varicose veins. And also she's having disc problems, and piles is there, back pain and knee pain. This problem that is creating back pain, and also it's already arthritis is also there, and gastrointestinal problem. She's having mouth ulcers, constipation, and piles, and discoloration and itching on both legs. So it is not asthma alone. Asthma is there, allergy is there, varicose vein is there, arthritis is there, and with the investigations, actually she is having the starting of pre-diabetic also. The HbA1c level is 6.1, and her GFR, the kidney function, is gone down. GFR is only 70, and the other some uric acid is high, and so I'm not going into those details. And she is taking actually in Kerala we have all other treatment options, not only modern medicine. She's taking homeo medicine, and also daily she is taking Budamet inhaler actually. That is one steroid bronchodilator and long steroid. That is formoterol and butorphanol. That is two combination inhaler is taking, and also she is taking some Ayurvedic syrup and homeo treatment also. With all this also she is not comfortable and uncomfortable, and also the varicose vein also is creating problem for her. In such a situation, she has come for the clinically supported lifestyle correction. And actually, in the clinically supported lifestyle correction, if the patient is following everything correctly, because her most of the allergens are removed, and also I forgot to tell about the allergy oriented result also. She's allergic to many commonly used food items like milk, lemon, mustard, and there's some inhalant allergy, cockroach test, house test, and also many food material. Even like in Kerala, the staple food is actually rice. She's allergic to rice, and also this wheat she's allergic, egg allergy, and so many vegetables also, cabbage, commonly used, nuts, so many so many badam, so many items are actually allergic also. So when it is removed, within 7 days, 8th day, the review itself, she was taking 2 times inhaler. So she is able to take, took only last 2 days, she had taken only 1 inhaler. Actually, every day she was taking 2, and now it is reduced drastically. And also she is able to, by the 15th day, she has come out of all the Ayurveda and homeo medication and all. Only 1 puff she is taken in the second week. So by the 30th day, she is not on any medicine. And the importance is, it is not only for the allergy and the arthritis and everything. She has relief was there. So by the 30 days, and the weight reduction also is there. And in the 30th day, she has come down to 62, from 67 to 5 kg reduction in the first month itself. And by 90th day, she is able to come down to 55 kg. So almost 12 kg reduction also. So that is the reason. Actually, by the 90th day, she is symptom-free, not only symptom-free, all the blood parameters, even the IgE level, IgE was very high, those all comes down to normal actually. Next, I can tell you one more patient. This is an young man, 22 years, and 182 centimeter height, and 89 kg weight. And his problem is, their own words, obesity, allergy, tonsillitis, head irritation, and depression. He is very irritable all the time. Actually, he has undergone a surgery 6 months back. And for this, because of the repeated respiratory infection and the septoplasty, nasal surgery, and adenoids was removed almost 6 months back. But his symptoms has no relief. He's always irritable. He says that his tongue is increasing in size, and his throat is irritated, and he don't know what to do actually. And the doctor, after this 2 nasal surgery and this adenoid surgery, he has no relief. And now the ENT doctor is telling him to remove the tonsil sac also, so that may help him. And he's not able to sleep. The sleep apnea is there, depression is there, and tiredness, and arthritis and this problem. Multiple problems actually. It is not only the allergy factor alone. So this patient, he's using some nasal sprays and itching, eye drops also he's using. And he has also tried so many other parallel mechanisms, also tried the allopathy, not only the allopathic medications, the modern medicine. He's also tried Ayurveda and the homeo, and because in Kerala all these different system of medications are available. So they have tried all this, and finally they had come to this clinically supported lifestyle correction. And the result is actually, he's usually what we see is within the 8th day itself, there will be marked difference will be there. By 15th day, he was 8th day itself, he has stopped all the medicines and the drops and all he has reduced. And he was able to, by 30 days, he was able to reduce 6 kg. By 90 days, he is able to come down, he was to 75. You should notice that the first patient also has able to the weight reduction is an important factor. Here also, he is able to reduce from 99 to 75 in 3 months. That is the thing which is actually his response to this allergen is different now. And also his throat, so much of fat is deposited in the throat, that is actually creating discomfort for him. His sleeping difficulty, even the depression. This fat is actually, this psychological problems also is because of this excess inflammatory reaction actually. The brain, inflammatory reaction of the brain will present as headache and depression, anxiety, irritability and all. So for the clinically supported lifestyle, when we look into the correcting the modulating the lifestyle itself, you get the clearing for all these things together in a proportionate manner. That is how much you are dedicated. That is the only question. And the special, even the, because it is the, his major problem is at the throat, the special exercise for the throat muscles and all is given. By 3 months he is totally symptom free and happy. He has joined for a new job actually. And after one year, actually his father came for the treatment. He brought his father for the treatment. Actually father only brought him, accompanying him initially. And now after 1 month, 1 year also, he's maintaining his health and he's totally symptom free. That is the importance. Actually, he need not to do it by, he was asked to do a tonsillectomy. Already one of the important immunological organ, the adenoids, is removed. And even this nasal, what we are saying is no need for, even if there is subtle deviation, there's no need for any surgery. The correct nasal exercises will, along with this correcting the allergy and other things, correct exercises for the nose will correct this deviated nasal septum and all. There's no need for surgeries for all this if you are willing for correcting your lifestyle. One more patient. It's a different, another type of allergy actually. This is a lady who is 56 years and 159 centimeters and 57.5 kg. She's not at all obesity, or there's no obesity. And she's having major problem is 1.5 years. Only recently she has started itching, and the problem is she gets bullous lesions. Actually, it's like after burns there can be the swelling, bullous lesions can occur. No? Just like that, large bullous lesions can occur. When we initially, when she came itself, she had 3-4 big ones. It's almost 10 centimeters long and 5 or 6 centimeters wide. Bullous lesions on the skin. It's just like the clear fluid is clear fluid, not the pus. Actually, clear fluid is inside. So it comes, and after a few days, it is painful, itching and all, and it will subside. But there will be darkening, will be continuing with it. And mainly it is appearing on hands, but sometimes in the chest and all is also coming. And she is having some gastric problems also. Even there is no bullous lesions on the face, but the edema can occur, edema also in the around the eyes. That is her problem. So usually allergy we are seeing wheal, itching and wheal and formation, but this is severe form. Actually, she's on 3 anti-allergic medications and some ointments also. Desloratadine tablet, that is an antihistamine, and montelukast, that is an anti-lycopene, and levocetirizine, and that is also anti-allergic. And because it is not comfortable, she's having allergy and sneezing symptom also, but her pressing symptom is this bullous lesions on the hand. And she was asked to take injections, that is this monoclonal antibody injection. That is quite expensive also. And before that, she wanted to try this, how she can. And actually, after starting treatment, there was a marked reduction in the first, this next week itself, there was no new lesions at all. And she was finding it comfortable. And she's able to, even with the normal weight also, we asked, her fat percentage was high. It was around 35% fat percentages, ideally only 25%. So she was asked to reduce her, she's only 59 centimeters, she was asked to bring down her weight to around 50. And also she was allergic to so many food items also, that is, we routinely look into allergic patients, food allergy in terms of IgE and IgG mediated allergies. And she's having many pulses like dal chana, it is a very common food here, and also dal, some sort of dal also, and milk allergy is there, yeast, lemon, so many. I'm not going to, it's all individualized, so not elaborating on this patient's problem. And she was actually, she was symptom free and very comfortable within 30 days itself, and no new lesions. But when she came to 60 days, she is telling a few small lesions, but it is not going to fullest lesion, but red lesions are coming. And when it is light, we are also giving, if there is a lesion, we give some anti-allergic ointments also. So otherwise also special body care, nutrition oriented is there. Along with that, if there is a symptom comes, because it should not go into bullous lesion and all, to prevent that immunosuppressive light mode of treatment also. But again also in this, it is occasionally coming. So we wanted to find out what is the reason actually. There is some allergen coming which is other than this. And when we looked into what is asking her whether she is using any cosmetic and all, then because it is coming, we wanted to find out whether anything cosmetic, because you don't have usually the people won't say any cosmetic. Actually, then only she revealed that she's a beautician. Actually, she's owning a beauty parlor. So she has exposure to other this hairspray and all. And actually, this lesions comes after this exposure to hairspray. So she with the occupation, she wrote only business. So we never expected. We didn't think of in that terms actually. Then after we understood, we had given given her instructions not to expose this to, because she cannot completely avoid, but use a mask and a full covered dress and such things we can avoid. Especially the people who's having allergy, they should not take any hair treatment. This allergy is always better. Avoid this perfumes and this air pollutants. They are acting as air pollutant, and also when your hair treatment, you're after this applying all these chemicals, they will be straightening with this hot air or this heating the hair also. That when so much of fumes comes out, and even if you have allergy, it's always better not to go to parlor visits. And if you are going special, there is other you don't sit with the others who is undergoing hair treatment, because this fumes come out can be creating problem for you. So the atmosphere in the parlor itself is a problem, and even the staff. Actually, there are so many studies. Even the cancer possibility is very high with this cosmetic exposure, especially the parlor hair treatment oriented chemicals. Actually, another patient. It's a child actually, 15-year-old boy. Is 166 centimeter height and 50 kg. He's not at all overweight actually. His problem is allergy. For many years he is having allergy, and now he has to take a morning and evening spray, nasal spray to go to school. If he misses, forget to take the nasal spray, he will be in trouble. And also he is taking regularly antihistamine tablet also. Bilastin plus Montelukast, 2 medicines for the allergy, and the nasal spray he is using. And the eye drops also, he is having reddening and the itching. So daily he has to use that. And also now his problem is he is having thyroid problem also. That is what I said. If a patient is having a long-term allergy, the other autoimmune disease, from the allergy to progression, is autoimmune disease. Like thyroiditis, all the skin problems can be like eczema or the psoriasis, or even kidney problem. First patient when we discussed whether kidney was affected. This patient actually the thyroid is affected, and the autoimmune antibodies are very high, and TPO level is very high, more than 1300, and ATG also 515, and he's on thyroid medicine also. Actually, initially we didn't stop the first week. We usually continue the same thing, the way, and the tablet is reduced, and by the 15th day he is reduced his even the nasal spray once a day, only in the morning, evening no, and by 30th day he was able to reduce the nasal spray in alternate days only, and no other tablet. Thyroid, actually he was taking thyroxine 75 milligram, he was able to come down to 25 milligram by 30th day, and by 60th day the thyroid tablet was reduced to alternate days, and 90th day no thyroid medicine actually. And his thyroid antibody level has come out not to come to reduced but not normal, and even the Ig level and the IgG level came down. All the inflammatory parameters, allergic and inflammatory parameters also came down, but the autoimmune antibodies, especially for the thyroid autoimmune antibodies for this Hashimoto thyroiditis, it will take long time to come down to normal. Some people it comes down very fast, But some it will take more time, maybe because of their lifestyle factors, which is we are not identified yet. But it is going down, and we are expecting by 6 to 9 months he may be able to, this antibody level also comes down. So that is the thing. And he's out. We see this not only the allergy, the autoimmune disease, thyroiditis is able to correct with the lifestyle modulation. That is the importance. We should all remember that this allergy and even the autoimmune disease are because of the lifestyle parameters, genetic predisposition. If you correct the lifestyle, it can subside. That is the importance. Another patient, her problem is different from the others. So each patient will be having different problem. Allergy will be there, they may be associated with the allergy. There will be other problems also. She is 44 years and 153 centimeters height and weight 68 kg. And she is having allergy, dust allergy from the childhood, and asthma also is there. And now she is having on and of increased heartbeat, palpitation is there, and some gas trouble is there, shoulder arthritis, shoulder pain is there. And now the problem is she had she was asked to do an angiogram also, and suspecting some heartache problem. Now she was on deriphyllin retard, that is another asthmatic medicine, and montelukast LC, that is montelukast and levocetirizine, that she is daily taking. And for the gastric problem, she is taking Rhapsody, that is rabiprazole and domperidone. So all these medicines she was taking for a long time actually. Now because of her heart problem, she is asked to take ecosprin AV75 and also Rhapsody. After starting ecosprin, her symptoms was increased. She has to take she has inhaler also she was using. She was frequent use of inhaler, and above all she wanted to avoid this angiogram also. So that is the reason for she is trying for this clinically supported lifestyle correction. And also she is having frequent headaches also coming. And when we look into the more details, there is some uterine fibroids are there, and fatty liver, chronic liver disease also, and also she is obese. And with the investigations also, she is having a anemia, and that is not that significant. I'm not going into the details of the other than all the details, because it will take a lot of time. And she's also having some allergies, even coconut, that is Kerala is one of the major ingredient in food. Coconut she is allergic, and she is allergic to milk, pea, egg, the pulses like dalchana, guava, even some fruits, and lemon, cauliflower, many vegetables, and also she is allergic. And basically we have stopped in this actually to avoid all these items, and the special nutrition support will be there to ensure all the nutrition she needed by the body is getting, and other things she can take from the whatever is not allergic. But she need to reduce her weight also. She is 68 kg, and she's having a very high fat percentage, is around the 38% fat. It's only ideally it should be only 25. So all this may be omega-6 also. That is why it is creating problem. This fat excess is the patient can predisposes to cardiac disease also, heart problem also. So with this clinically supported lifestyle correction, she's able to reduce the weight from 68 to 56 in 9 months, in 3 months actually. So her fat also came down to 29%, from 38% to 29%. And definitely the abdominal circumference, she had a protruding tummy, 95%, 95 were her initial abdominal circumference. It came down by 90 days, it came down to 75. So the body has to, in clinically supported lifestyle correction, what we are trying to do is to correct the body. With that, you can come out of all these discomforts actually. And even she was taking so many antihistamines and all. By 8th day itself, she has come down, reduced to occasional. Only once she was able to. And the 15th day, there was no antihistamine was needed. And later on, only if usually we advise the patient, we'll give some light antihistamine if a skin problem is there, for the local application ointment, and also for SOS medicine. That means if an exposure, we cannot avoid, sometimes if you go out and some functions, wedding, or you are attending a function and buffet you are taking, some triggering items can come, then, or some exposure to some air factors like this room freshness and all, she can get a problem, and then take a emergency, or suppressants can be taken and manage. So keep the body composition correct and avoid the allergic food. But once the body composition is corrected, they can, even once in a while, exposure will not create a problem. That is, the immune system is getting corrected, and this aggressive nature of the immune system, this inflammation is reduced. Then even if you take a allergic moderate quantity, you will not be symptomatic. That is what we are saying. So remember that all these diseases are of lifestyle origin. So if you are able to modulate lifestyle, you can come out of not only from allergy, asthma, the other metabolic disorders like diabetes, hypertension, also other things. All the lifestyle disorders can be reversed actually. The focus of clinically supervised lifestyle modulation is not on the symptoms. Focus is on the lifestyle parameters to be corrected to set right the undesired variations in the body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patient can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from diseases is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from the ill effects of chronic medications, or when the surgery is under consideration, the need for clinically supported and supervised lifestyle modulation becomes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatments with the emphasis on the benefits of lifestyle correction from the website and YouTube playlist. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding the symptoms, current diagnostic methods, and treatments along with the benefits and side effects. Practical aspect of the lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical, and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.